Welcome everyone. I'm Karen Grace Clark, Program Director for Gold Lactation Online Conference. I'm here today with Dr. Frank J. Nice, and we are talking about his presentation at our conference titled Domperidone and Breastfeeding. I'm going to jump right in and ask Dr. Frank Nice a couple of questions here. One thing I would like to know, Frank, is why are you interested in domperidone and its effects on breastfeeding?
Well, the fact is, I am a pharmacist, and I've been working with medications and breastfeeding for a long time, and I've seen a lot of women with insufficient milk supply, and basically they're limited to herbals. Not saying herbals aren't good, but there should be a good prescription drug on the market, and there isn't at this point, and I think domperidone is the ideal prescription drug for insufficient milk supply.
Excellent. Thank you very much for pointing that out. And this raises another question for me because I live in Canada. I know you are in the USA, and many of our listeners are from other places around the world. Here in Canada, domperidone is readily available via doctor's prescription, and in some countries it's even available over the counter, or so I've heard. But in the USA, there's some controversy about its use, and it can actually be quite hard for mothers to obtain. Why do you think that is, Frank?
Well, there was actually more than just a little controversy in the United States about this drug, domperidone. The fact is, though, that in every country in the world where it is available, whether over the counter or as a prescription drug, it's not available as a prescription drug for insufficient milk supply. It's basically used for gastric motility. And in the United States, because of that, there's some misconceptions, I think, by the FDA about the use of domperidone. And since it's used mainly for gastric motility and it's used in other forms by older people, by IV form, it's not the form that would be used in the United States or any country. It would be the oral form for insufficient milk supply. And also, I have experience with orphan drugs. The orphan drug status is a way of getting the drug on the market. Domperidone does now have orphan drug status in the United States, and that is one of the things I'm going to be discussing in the presentation. So I think it's a lot of misconceptions out there about the safety and effectiveness of domperidone for insufficient milk supply.
Very, very interesting. I'm really interested to hear more about this orphan drug status, so I know I'm really looking forward to your presentation at Gold. Why, Frank, is it critical for healthcare professionals to have the information you will be presenting in your topic at Gold?
Okay, the information I'm going to be presenting is going to be some of the most comprehensive information, if not the most comprehensive information, that will be available on domperidone. I will be talking about the orphan drug process in the United States, how we're going to try to get the drug approved for insufficient milk supply. But at the same time, I'm going to be giving everything from A to Z that's available on the use of domperidone, both as a drug for motility and as a drug for insufficient milk supply. And as part of that presentation, I'm also going to be presenting about drug dosage, withdrawal when there is sufficient milk supply that is produced by the drug, and whether there's insufficient milk supply being produced. I'm going to be presenting different algorithms and procedures for using the drug. So I think this presentation is going to give healthcare, but not only healthcare professionals, but lactation consultants who are also healthcare professionals and mothers themselves, any information and all information that is available on this medication, domperidone.
Excellent, excellent. Thank you so much for sharing that with us today. It does sound like this is a very important presentation for healthcare professionals all over the world, and especially those in the USA where there is quite a bit of misconception and controversy about this particular medication. Frank, thank you so much for joining us today. It was a pleasure talking with you, and we look forward to seeing you and participating in your presentation at Gold Lactation 2014. It's coming up in just a couple of weeks, and to everybody listening today, today, I would invite you to join us online at www.goldlactation.com. We do have a free keynote presentation live online on April 14th and available as a recording until April 21st when our conference officially begins. I hope that everybody will log into our website and register and join us to hear Dr. Frank Nice talking about domperidone and breastfeeding. Once again, Frank, thank you so much for being here today.